All right, folks, thank you for being patient with us tonight. We do have a short agenda, so we're not going to keep anybody late. But the Albuquerque-Bernalillo County Government Commission meeting will come to order. For the record, Commissioners Quezada and O'Malley and Councilors Pena and Harris are excused. Commissioner Piscotti may be joining us later by phone if we need her or if she's available. First, we'll begin with a moment of silence tonight and then the Pledge of Allegiance. And tonight we'll ask Councilor Benton to get us started with those, please. Thank you, sir. First up on the agenda, we'll take the approval of the minutes. Are there any changes to the March 28th meeting minutes? Hearing none, do I have a motion to accept or to approve? And a second? Second. All those in favor say yes? Yes. And that item, the minutes are approved. Next up, we'll have public comment. The light on the podium, when we call your name, please come forward. The light on the podium will be green for the first minute and a half, and then the bell will ring. And then the light will turn yellow, indicating that you have 30 seconds remaining to wrap up your comments. At 2 minutes, the light will turn red and indicate that your time is up. And first up tonight, we have Ms. Connie Vigil. Ms. Vigil?
Thank you, Councilor Davis, and also Council and sorry, I'm nervous. Council and Bernalillo County representatives. I'd like to pass out this information. You may have seen it already. This was published in January of this year in the Albuquerque Business First. As you know, I represent the Greater Albuquerque Business Alliance. Just wanted to do a really quick update. I appreciate the fact that you have behavioral health as a top priority. I appreciate the fact that Carol Pierce and Katrina Holcomb are here. And I just want to tell you that Greater Albuquerque Business Alliance has been working hard and will continue to work hard to support the city and county in going forward on a housing project we now call Gabriel's Village. We propose to house at least 150 people. And the good news is I've had alliance meetings with 4 major nonprofits, including Meals on Wheels, Locker 505, and Cuidando de los Niños. Also, the Veterans Hospital has reached out to us, as well as the Carpenters Union for job creation. And we are really excited to go forward on this campus. So I just wanted to let you know that we are still working forward on that. We have many proposals in the works for private donations, and we look forward to working with city and county to help as a business community to provide part of the solution. And again, I really thank and respect the county for coming forward in the city as well. Thank you so much.
Thank you, Ms. Vigil. Next up, we have Alfonso Mirabal.
Good afternoon. My name is Alfonso Mirabal from Holy Rosary Catholic Church and leader with Albuquerque Area Interfaith. Albuquerque Interfaith is a broad-based organization made up of 14 member institutions across Bernalillo County. We are nonpartisan and committed to developing leaders and strengthening the institutions in our communities by working on issues relevant to our families and neighborhoods. We are here today to present our current set of priority issues to the ABCGC. There are 4 priorities. These issues have been developed through hundreds of conversations, including small group meetings, research actions, planning meetings, and organizational-wide meetings. We will also be scheduling individual meetings with each city councilor and county commissioner to have a deeper dialogue about these priority areas. And I think you've been given a copy of the 4 priority areas. Thank you.
Thank you, Mr. Mirabal. Next up, Sean Morris.
Good afternoon. My name is Sean Morris. I'm from Van Buren Middle School and a leader with Albuquerque Interfaith. I'll be addressing our priority issue focused on access to health care. One of the casualties of the previous state administration was fully funding school-based health centers. The legislative session that just ended also did not provide adequate state funding to address the important institution and underserved communities getting access to health care. Currently, there are 14 school-based health centers serving students and families who attend Albuquerque Public Schools. Albuquerque Interfaith requests to the city and the county is for $250,000 each to fill the gap for school-based health centers. The money could go to the New Mexico School-Based Health Association, who would then distribute to the school-based health centers. Thank you for your time.
Thank you. Next up, Reverend Liz McMaster.
Thank you, Chairman Davis and members of the council. My name is Liz McMaster from St. Andrew Presbyterian Church and a leader with Albuquerque Interfaith. I will be addressing our priority issue focused on homelessness. ABQ Faith Works is an innovative pilot project with 9 Albuquerque congregations: First Congregational, First Unitarian, Monte Vista Christian, First United Methodist, St. Thomas of Canterbury Episcopal, Albuquerque Mennonite, Community of Hope, St. Mark's Episcopal, and my own St. Andrew Presbyterian. 5 of these churches are member institutions of Albuquerque Interfaith. ABQ Faith Works will create a pathway out of homelessness by hiring a full-time social service coordinator working alongside church volunteers to provide longer-term help, such as counseling, housing, and jobs. We hope to provide a model for other churches across Albuquerque to establish similar programs for our homeless population. The cost of this program is $80,000 a year. The 9 congregations have each raised $5,000 for about half of the budget, and we seek matching ongoing funds from the city and county. Albuquerque Interfaith's request to the city and the county is for $20,000 each in recurring monies for ABQ Faith Works to match the monies already invested by our congregations. Thank you very much.
Thank you, Liz. I just want to say I encountered this project in its infancy, I think at First Unitarian. It was just a fabulous idea at the time. And I'm so impressed the churches have come together to put their own congregations and to donate and to set up the infrastructure on their own and then to come ask for matching. I think that's a huge, says a lot about the community and their willingness to take this on their own. So thanks for doing that. Thanks. Next up, Mr. Chris Sandoval.
Good afternoon. My name is Chris Sandoval, and I'm with St. Therese Catholic Church, and I'm a leader with Albuquerque Interfaith. I'll be addressing our priority issue focused on land use. The zoning in the historic neighborhood of Santa Barbara, Martinez Town, has been changed in the last 2 years in an attempt to rectify years of neglect. Unfortunately, the consequence of that is that more than 200 homes are out of compliance. The city has developed a process for individual homeowners to apply for rezoning so that they won't be out of compliance, which includes covering the cost of surveying, which is about $1,200 per property. This rezoning process has a current deadline of May 16th. More than 50 homeowners have been able to submit for an application for rezoning. There are 3 Albuquerque Interfaith member institutions involved in this effort: Santa Barbara Martinez Town Neighborhood Association, St. Paul Lutheran, and Second Presbyterian. And Albuquerque Interfaith's request to the city is to extend the deadline for the rezoning process for another year, including covering the cost of the survey, so that homeowners can submit their applications. There's still 150 homes that need to apply for that, and I think it's getting really late on that. So thank you.
Thank you, sir. Next up is Ms. Pauline, and I apologize, I couldn't read this other name. I did Autry? I know that's not right. Artery. Thank you so much.
Good evening, council members, and thank you for giving us the time to come and share our concerns with you. My name is Pauline Artery, and I'm from St. Mark's Episcopal Church, and I'm a leader with Albuquerque Interfaith. I will be addressing our priority issue focused on immigrant justice. Albuquerque Interfaith has gotten involved in the asylum crisis through multiple member institutions with the leadership of St. Andrew's Presbyterian and St. Therese Catholic Church. The focus has been on providing charity work involved in the immediate crisis to fill the gap created by the federal government not doing its work. While urgent, this work is unsustainable. The charity work is focused on providing temporary housing for the asylees while we connect them with their sponsor families. Our ask to the city and county is to explore putting money in their budget to address this charity work for the short term. This is building on the work already happening with the city and county as a partner in addressing this issue, and we are proud of that partnership. There is also work on developing a justice strategy that we would like to talk to our city councilors and our county commissioners in individual meetings with constituents, and we would like for them to know what we are doing. Thank you very much to the ABCGC for allowing us to come and share our concerns and our asks with you.
Thanks so much. Next up, Ms. Janet Sayers.
Good evening, members of the council and commission. My name is Janet Sayers. I'm the president of the Del Norte High School Alumni Association. And until 2012, I didn't know or care what was going on, really, with public schools and the school I'd attended, Del Norte, and the schools in that neighborhood, which include Hodgen, Bel Air, McKinley, Cleveland, and Arroyo del Oso Elementary. And so since 2012, I've had a crash course in understanding public education and what life is like in a typical public high school. And the days of boundaries where students go to the high school in their neighborhood, that's long gone. Students come to Del Norte High School at San Mateo and Montgomery from 5 miles, 10 miles, 15 miles. They no longer go to their home high school for a lot of reasons. It could be family reasons, it could be job reasons, it could be because they were a refugee family that started out at the corner of Carlisle and Montgomery. The family was able to get housing in a total different part of the city, but the student wants to stay in the school where they had made friends. Our Alumni Association over the last several years has spent about $500 purchasing bus passes to give to students who school's out at 2:30. If you want to stay and participate in an extracurricular activity, you're out of luck. You're either walking or coming up with the money or quarters and transfers and et cetera, et cetera. I just learned about this meeting last night when Barbara Peterson from the Board of Education mentioned it. I will be coming back. I will prepare some official comments from our group, but I cannot think of anything more important than a cooperation between APS. Oh, I got the little.
Go ahead.
little
You can
thing.
finish that, Ms.
I'll
Sayers. Finish
my
that
thought.
comment there.
I can't think of anything more important than this topic of expanding transit options for youth.
Thank you.
So
Thank you.
thank you for that
Thank you,
being a
ma'am.
topic of the commission tonight.
Thank you, ma'am. Next up and last is Mr. Tad Naminsky.
Thank you. My name Ted Nemiski, and I'm speaking to the board of 35% or less. Where is that? How affecting this board is when only 4 of 9 show up, listening public comments. Now let me go to my topic. That's right. Psychology for profit. lip work or pushing drugs. Of course, legal drugs, like marijuana now, it is legal too. Oh, well, what is attached to anything legal, like marijuana, alcohol, and so on? Taxes. Give it government institution, dip it for more our taxpayer taxes. That's right. Look at how much bottle of whiskey now. Well, that's right. I do not drink. I'm sorry, Benton. You may drink. You can have it. I done it on my own. Quit. So anyway, oh well, yeah, I got 48 seconds. We do have shrinkers, and many of them working for businesses, of course. Oh, I'm sorry. Private and government. Oh, well, that's explanation, partial. In the name of money, not God. Now, also, what gets me too, we have separation church and state. Well, those are easy money right here too, for some people, for some so-called non-profits. How good they are.
Thank you, Mr.
I'm sorry you don't want to hear it, because I am
you, Mr.
politically incorrect. I've got to slam them more.
Thank you, Mr. Minsky. Next up, we'll move on to our new business items, and first, we'll turn it over to Commissioner Hart-Stebbins.
Thank you, Mr. Chairman. And I would like to invite anybody who is in the chamber today who has been involved one way or another in behavioral health and addressing gaps in this community to please come to the podium. That would be many of the people in this chamber. Our county staff, Sam, I see you there. Carol. Anyway, because we have this Margarita, because we have this proclamation from the ABCGC recognizing Mental Health Month, and I know that everybody who is standing and lots of people in our community have been very engaged in this particular issue. So I want to thank you all for being here. Thanks for your work. And this proclamation from the ABCGC is sponsored by Stephen Michael Quezada, Pat Davis, Debbie O'Malley, Clarissa Pena, Ike Benton, Charlene Piscotti, Don Harris, and Tim Keller. And it reads, whereas mental health is essential to overall health and well-being, and whereas an estimated 1 in 5 adults in the United States, that's 4.3 million individuals, or 18.5%, experiences mental illness in a given year. Approximately 1 in 25 adults in the United States, that's 9.8 million or 4%, experiences a serious mental illness that substantially interferes with or limits one or more major life activities. And approximately 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life. And whereas there's a strong body of research that supports specific tools that all Americans can use to better handle challenges and protect their health and well-being. And whereas mental illnesses are real and prevalent in our nation, and whereas we have far too often witnessed the tragic consequences of untreated mental illness in our community, from substance abuse to homelessness and incarceration. And whereas with early and effective treatment, those individuals with mental illnesses can recover and lead full productive lives. And whereas each business, school, government agency, healthcare provider, organization, and citizen shares the burden of mental illnesses and has a responsibility to promote mental wellness and support prevention efforts. And whereas the Albuquerque-Bernalillo County Government Commission has prioritized developing a behavioral health continuum to meet the needs of consumers, family members, and constituents as a whole, now therefore be it resolved that the Albuquerque-Bernalillo County Government Commission does hereby recognize May 2019 as Mental Health Awareness Month, done this 18th day of April 2019 in Bernalillo County in the state of New Mexico. And this is has a seal of both the city and the county. So just wanted to thank all of you Katrina, actually, any of you who are here are certainly welcome to talk about your work and your commitment and some of the wonderful accomplishments that you have all reached over the last period of time.
Thank you. I just am pleased to be here and for us to be honored, and there's so many more people who are not here that should be honored as well, and our subcommittee members and all the people who are putting effort into building a behavioral health system. I think it says a lot for the city and the county to collaborate and have meaningful collaboration as we do in making sure that we are putting systems together that are going to be meaningful to our constituents and meaningful to the public and provide a safety net system for everyone. And so I'm just honored to be part of this, and thank you.
Just to put you on the spot, Carol, thank you.
Yes, no, thank you, all commissioners. I don't want to duplicate everything Katrina said, but I'm very grateful for the collaboration between the county and the city. I think we each have a different role, but I think coming together, we have a greater impact for our community, and I'm very appreciative of the relationships we have and how we're maximizing our dollars by working together.
Thank you all so much. And
Yeah, would you like to come up and we?
good.
Like
Well,
to-
maybe we'll designate somebody. Katrina, would you come up and take the proclamation if you don't mind? We'll share it with our subgroups and our subcommittees. Yes, ma'am.
Katrina.
Thank you. Next up is an item that I asked us to add to our agenda tonight. Over the last several months, some students in the International District and the South Valley have been organizing through Together for Brothers and others to look at some options for transit equity in our city. It's one of the things that the city's transit system has found as a challenge is that we've been losing ridership. But then last summer, as Ms. Sayers mentioned, last summer as we provided bus passes to students through Together for Brothers and some other organizations, we actually saw ridership increase for the first several quarters in some time. And looking back on that, we realized that the more access we provide to young people for our transit system, it certainly helps increase our ridership numbers, but it also opened up a world of opportunities for young people, from education to summer programs to after school and others. And so the young folks at Together for Brothers made a presentation to the city's Transit Advisory Board last week that seemed pretty timely because we are in the middle of the city's budget process. And so I asked them to come and share that with all of us here because I think we from APS, the city and the county, all share an interest in trying to improve outcomes for our young people. And this is one of those that we have an opportunity to do. It received unanimous support from the city's Transit Advisory Board, and we've since been working with the Transit Department to figure out the fiscal impact. But first, we wanted to give those students an opportunity, and I see Mr. Ramirez and those young people, Xavier and others, that are here to tell us a little bit about what they've discovered about transit access and opportunity in Albuquerque and their proposal to make transit equity a centerpiece of city values. So, Mr. Ramirez, welcome.
Yes, good evening, Chair and Commission. So we're going to try to, you have the information in front of you, so I'm not going to read it verbatim, but I want to make sure that it's available for everybody, right? Thank you for your help. Thank you for your help. So we're Together for Brothers. One of the things that we want to do is to talk a little bit about who we are and why we're here tonight and how we got here, and a little bit about our health impact assessment. That's an HIA that we've been completing since 2017. And what we found, because we talked to a lot of young people here in Albuquerque and have done some work since then around transit and transit equity. You can check out our website for more information, togetherforbrothers.org, but we're an organization here in Albuquerque that works, and I'm really proud of this. We work with love. That's one of the important concepts in our mission statement. And we primarily are working in neighborhoods across the Central Corridor, in Westgate, downtown, and the International District, because we found it's where the most transit-dependent families live here in the city of Albuquerque. And one thing that I'm also proud of is currently about 27 young men of color our consultants are work with Together for Brothers on our staff, including some of the young people who are here tonight. Can you help with the paper? Yep. Thank you. Thanks, Xavier. So real quickly, why a youth bus pass? Some of you have actually, I know Councilor Davis and Commissioner Hart-Stebbins have both been able to meet with some of the youth with Together for Brothers from their constituents, from their neighborhoods. But why a youth bus pass? Health equity, for one. We'll talk a little bit more about health equity. For sure, an economic impact. And one of the things we're happy to be able to do is work with APS to really talk about an economic impact of students in school. And we'll talk about what we found when we asked young people if they had a bus pass, if they were more likely to be on time and go to school. And then also the economic impact of finding and keeping a job here in Albuquerque, especially for young people that live in neighborhoods where jobs are scarce. And so they have to move to other neighborhoods in order to access those jobs. And then, of course, one of the big ones we want to really compliment is when young people are able to access transportation, they can be part of their community. They can be part of going to community centers and take part in mental health opportunities like Carol and all the other staff that Family and Community Services offers for young people across the city. And on the back of that. And just real quickly, I want to say there are a lot of communities that offer bus passes. And the two that I want to highlight, Santa Fe and Los Alamos, currently, students just have to flash their student ID, just like the UNM and CNM students do in Albuquerque, but all the Santa Fe public students and Los Alamos public school students ride the bus for free in those two communities. And you can see other cities that offer some type of transit pass. So a little bit about our health impact assessment. Since 2017, we've had teams of young people from neighborhoods most impacted be able to do the research. One-on-ones, interviews, focus groups, surveys, all done by young people. And what we're excited to tell you is in 8 different languages in Albuquerque, right, that young people speak. And so a lot of that was done because young people, like the ones you see here tonight, were able to do that with us. And that included collecting, but also analyzing the data, and then working with community partners to actually develop short and long-term policy recommendations, which includes, right, one of the things that we were able to do last summer was work with the city to provide a summer youth bus pass that the mayor and the transit department pushed. 1,500 young people received bus passes. And what we're doing now is saying, how would we take that how do we expand that even farther? Some key things that I know that you're familiar with, maybe, or not familiar with health impact assessments. The young people actually determined there were 4 health determinants that were most impacted with access to transit, and that is education, employment, recreation, and also promoting healthy habits, which includes access to healthy foods. A lot of our young people in Albuquerque live in food deserts where they don't have access to healthy food. And that includes young people in the South Valley and Westgate who live next to farms, right, local organic farms where they actually produce those vegetables, but aren't able to buy them. And so I just want to highlight some of the information you all have in front of you. What we found for sure is that young people were more likely, and you can read in this first one, the big one was recreation. 80% of the young men of color that we talked to, right, almost 300 surveys and other focus groups interviews we did, said they'd be more likely to participate in recreational opportunities if they had a bus pass. Over 70% said that they would be more likely to find and keep a job. The other data around education is 71% also said they'd be more likely to go to school if they had a bus pass, if they had a way to get there. And then finally, that they would be more likely to participate in other activities in the community. So I want to say we've done some transit equity work with the city so far, primarily, although we've worked with Commissioner Hart-Stebbins as well, including making some connections with the Middle Rio Grande Council of Governments to talk about possibilities working even with the rail runner. That was a meeting that she set up with us. But since we worked with the city last summer on the bus pass, we were excited to collaborate with the city this past February 4th for Transit Equity Day. It celebrates Rosa Parks' birthday, and the city offered free bus service that entire day for everyone in the city of Albuquerque. And then most recently, as Councilor Davis said, we presented at the Transit Advisory Board a letter to Transit Director Bernie Toon asking for 3 specific asks. And that is that we'd like to receive monthly passes. We literally get daily requests from the community for bus passes. We'd also like to have young people at the table to plan for the summer bus pass program. And we'd like to work, like we're doing right now, on a permanent youth pass with the city, county, and APS. And then I wanted to just highlight, and Xavier reminded me of this as we were getting ready for the meeting today. We've been really lucky to work with a lot of people in the community. We have school board members that have supported what we're doing, city councilors, county commissioners, and a number of community organizations. But one of the things I was most excited about in the last couple of weeks is we've reached out to the funders that support us, Albuquerque Community Foundation, McCune Charitable Foundation, NewMexicoWomen.org, that have supported the work and they typically don't get involved in policy issues. But all of those 3 of our major funders all signed on this transit equity letter saying how important they understood transit equity was to young people's health and their success. So we are looking forward to working with the city, the county, APS, and other partners that want to be part of moving forward with this. And we know that there are already existing opportunities like the UNM and CNM MOUs that transit has, so that students and faculty and staff within those institutions can ride the bus. We look forward to the opportunity to work with all the institutions to make that happen here in Albuquerque.
Councilor Ben.
Thank you for this. I mean, this is such an important perspective to bring before this body, and I think, we've had discussions about looping in APS to this body. We decided not to just put members on this board, but I think we've got to go in that direction. A lot of discussion in the past few years with the transit district and the regional transit district and the regional transportation board about the whole interaction and the whole thing of people trying to get their kids to school. But the independence of being able to use transit, as a teenager and as a student, that was my freedom, was to use transit. And it wasn't the greatest transit system, but it was a transit system, and it was affordable to me. San Juan, Puerto Rico, it was a dime without air conditioning, 25 cents with air conditioning. So you can imagine what that's like in the tropics. Yeah. But I was usually with the dime, of course. Yeah. But anyway. Yeah, it opens so many doors, and it's a no-brainer, and we should pull together and do this. I just wanted to ask you, I mean, it would seem that it would be the kind of thing, and I know between the city and the county it's not quite the same thing, but APS goes beyond all of both the city and county, and how do we make that work? How do we, of course the city owns the transit asset, but we don't have a lot of operating funds for the transit asset, I'm sorry to say. And then we've got the parents and the students and all the other needs. So I really want to help with this. I think it's a terrific proposal.
And Councilor Ben, if I can respond, and maybe one of our youth can also share, right now it's only 35 cents for a young person to ride the bus. Mm-hmm. But one of the things that we learned and we want to point out, and this is in the information, the turquoise fact sheet, only about 10% of the youth say they ride the bus. So we're not talking about potentially large numbers, right? It's just like UNM and CNM, not the entire student population rides the bus, but for the folks that need it, like you said, it becomes such an important opportunity, an access to opportunity. But 35 cents is a limitation for a lot of our families in Albuquerque. Sure. And for the students that don't have it, the stories that we could tell you of, it's like playing the lottery. They get on the bus and they say, I don't have money today, can I still ride the bus? And the bus driver gets to decide, right, 50-50. Are they going to stay on the bus or do they go? Yeah. Will somebody on the bus come up with 35 cents for them? Right. And then I love what Ms. Sayers commented on is, what we found, especially because of the Highland High School students is the group that we find has the most need, is if a student wants to stay after school and depends on a school bus to get home, which a lot of our refugee students do because they don't live immediately in the Highland area, then they're denied because there's not an after-school bus, after-school activity bus.
Right.
So students are basically limited to not being in any of the sports, school activities, tutoring, mentoring opportunities that they have at the school because they can't, right? They can't actually get home on their own without access to. And we've seen that with participation in the program that we do at Highland, where participants have said, hey, if you can't get me a bus pass, I can't do the after-school program. And we don't want any young person to be limited by what they can and can't do based on their income and not being able to afford 35 cents or 70 cents or whatever they need to be able to access opportunities in the city.
Mr. Chair, I really do agree 1,000% with what you're saying, and I think there's transit equity is a mountain to climb across the board, and we need to climb it because that's what it was always about was accessibility for everyone, and one thing about providing these passes, even if it's let's get them on the bus. I mean, let's encourage people to be on the bus, and someday when everybody's got a job and a career, then hopefully they'll still be riding the bus. Exactly. And keeping one less car out on the trying to get across the bridge of the Rio Grande or whatever it may be. So thank you for.
Of course, and thank you for pointing out the environmental impacts of this as well, for creating lifelong transit users, right?
Yeah.
Thank you. Councilor, Commissioners, other questions? Commissioner?
Yeah, thank you, Mr. Chairman. Great to see you. I'm sorry I haven't followed up with you in a while, but I do want to follow up on what you mentioned about reaching out to Rio Metro. Did anything ever come of those conversations?
Only that there was the interest. And what was exciting was, and I think I learned this when we were meeting with them with you, was that similar to the way that they offer veterans free access, that I originally thought that was either a grant or funding, but they did that because of work that they were doing with access to the VA and realizing that they could easily just kind of eat the cost, right? There was no funding, right? There was no government grant or specific allocation when they decided to do that. So that's why there was strong interest. We were focusing on the city, which is why we didn't move forward with that, but we should definitely continue because we know that would impact young people in 4 counties right here in central New Mexico, because there was definite interest in looking at the possibility of at least looking at some of the fiscal impacts and the reality of if Mr. Cog could do that for the rail runner. And then what would be great is then it's all the transit. If we're giving rail runner passes, then it kind of by de facto, right, has young people riding buses in Santa Fe and Valencia County and here in Albuquerque as well.
And I'd like to follow up on that. I know Councilor Benton and I are both still on the Rio Metro board and see what the involvement would be there. I know that Mr. Cog also houses the Workforce Solutions or Workforce Connections. I always get them confused, but there is a component of helping young people access employment, and so there might be a way to try and pull that together. So we'll see if we can set up a meeting to see whether that can be a component of this program.
And Commissioner Stubbins, can I actually have Isaiah, who's one of your constituents that lives in the International District and goes to Tech Leadership High School. He started working with us in January, but also has an internship. And can he respond to how he's been able to work?
Yes,
to work, because one of the things is we've given him some of the free bus passes we've been able to get from the city, but I'd like Isaiah to share if we can.
What's going on, everybody? I'm Isaiah Ventura. I go to Technology Leadership, and I live in the International District, and I have 2 jobs, one in Together for Brothers, and I'm also an intern at a company called New Mexico Mutual. And I really support this because, my mom, she's really busy. She's a single mom. She works really long shifts, and she's not able to always take me places that I need to go, And I got a job. I'm always trying to make money, Gotta buy me some video games and stuff. But yeah, but yeah, this really helps out, and it's not only for work or school. It's also to go to the mall. When I want to go hang out with my friends, or, go do something fun, go watch a movie. This doesn't also impact education and all that. It also impacts just wanting to have fun, wanting to go out and go invest in the city, Go invest in some local businesses, go buy something from a local business or something. There's a lot of positive outcomes that come with this. It's a domino effect, And that's why I just really support it. I just really think it's a really good idea. I mean, like Isaac said, it's really a no-brainer, and it's really helpful. And thank you guys for your time. Thank you. Are you got any questions?
Sir, can I ask you a question? Did you say you are working at New Mexico Mutual?
Yes, ma'am.
Isn't that office way out on Alameda?
Yeah,
you take the
it's
bus
by Balloon
there?
Fiesta. Yeah, I live by Wyoming and Central, on Wyoming and Central. So it's a 1-hour bus ride. So yeah, but you gotta go work,
It's good. I hope they're treating you well.
So yeah.
I was on their board for a period of time, so I'd like to keep up with how they are serving our community. So glad to hear
Okay.
that you are there.
One of the other recent opportunities, we work with Three Sisters Community Kitchen downtown in Albuquerque, where we actually meet on Monday nights, where Isaiah actually facilitates a group at Technology Leadership High School with another young person. And Monday nights, they come in together with other young people from all across the city, 14 youth organizers for the 7 sites that we work with. But what's great is Three Sisters Kitchen also offers a fresh RX. It's a free, so every Wednesday, Isaiah can take the bus down to Three Sisters and pick up fresh local veggies. He's actually, I was complimenting him because he's one of the youth that has gone every week in the 5 or 6 weeks that we've been in the program. But again, that promoting healthy habits, he wouldn't have had that opportunity to come from where he lives to Three Sisters without using the bus, right?
For sure.
Thank you.
And yeah, to add on that, the Three Sisters Kitchen, they provide like free, it's a farmer's market, and I get stipends because I signed up for their program, and I get free fruit. I just go there after work, go take the bus over there, go pick up some free fruit, and then go back home. And everyone at my house loves it too. They have some weird fruit. I mean, they got some weird fruit, but it's pretty good. So
Awesome.
yeah, that's about it. Any more questions?
Thank you, Isaiah. I want to give, there's some other folks I think we've invited to give some comment, and so we'll come back to you guys at the end once we let some other folks speak.
For sure. Sounds like a plan. Thanks, guys.
Isaiah, Chris, thank you.
Thank you.
I know we're conflicting with a couple of meetings tonight. I want to, as other folks have, acknowledge that APS board member Barbara Peterson has been working on this with our Highland students. She's doing her own town hall at Highland tonight with some of these other guys, so she's not able to attend. But I want to acknowledge if there's anybody from APS here, we can pinch hit a little bit because I know what they're going to say. The other side of that is if there's anybody from transit, we also have their notes because I know they have another meeting tonight as well. But I'm sorry, do we have APS? Is that Scott? Come on down. Do you mind? We just wanted to give APS a chance to talk just a little bit about what APS transitioned a couple of years ago, maybe last summer, to its own transportation division and sort of how that works and what are the limitations there that still rely on other transit options.
Okay. Mr. Davis, members of the board, I apologize, I didn't realize I was speaking tonight, so I'd come to be educated and to learn, but I'm happy to share anything you'd like to know about APS. So it's actually been about 5 years that we've had to have our own transit system. We are now currently the largest transit system in the state. We personally, the district has about 220 buses that are the district's, and then with our contractors, we're over 500 buses. We run 39,000 miles a day. We transfer about 42,000 students a day. So a large portion of our budget goes to transferring special needs students. You may know that Albuquerque is now the largest provider for special needs populations in the state. What we've discovered is happening is that as the rural cities struggle more and more with providers, that parents who have children with special needs move to Albuquerque. And so we're actually seeing an explosion in our special needs population, which has forced us to move quite a large segment of our transportation dollars to a smaller number of students, but who have intense needs that we have to move to very specialized programs no matter where they live in town. I think we are supportive of this initiative. We're interested. There are some barriers for us that deal with more with statute and the way that transportation dollars can be utilized. I will tell you that I'm an ex-principal. I was at Highland myself for quite a while. I used to write into my grants bus passes, and so it was not unusual for me to keep, a couple hundred bus passes on at any given time for students like these young men who would say, I'd like to stay for an after-school program, but I don't know how to get home. Not a problem. So I think there's ways we can be of assistance and that we can do more to be supportive of what you're trying to do. We actually started this conversation with the previous administration, and it just kind of stopped because some of the barriers. But I think we're more than interested in continuing the conversation. And to that end, we also have board member Elizabeth Armijo is also from from APS as well. So we're very curious what you're thinking and are more than willing to come to the table and visit.
Thanks. Thank you. Councilor Benton.
Just quick question, just musing in a way. The city runs this, or someday soon, hopefully, we'll have the spine of a transit system, of a high-capacity system. And I wonder, do you see any potential for your bus system to tie into that, to be more of a, I don't know, to be kind of a collector that also ties in and how do we call it, leverage that city investment as well as
I'd
the
love to.
school's investment?
I think we'd love to see that. So some of the issues we run into, so for example, one thing we were talking about was we have a real problem, sort of similar to you, that the west side is exploding.
Yeah.
And we don't have a west side bus depot. And we're going to, but we just don't have it right now. We actually approached the city and said, is there any way we could maybe jointly share your depot, put just a few buses out there? And we ran into some issues with the commingling of funds because we're state generated and you're mostly federally generated. And that really became an issue because gas is gas. It doesn't care who bought it, right? So there were some issues. But I think with some real talking, it would be interesting because we're going to, at some point, we have to, what's going to happen is with these mom and pop contractors they just can't afford it. And eventually we are going to be the transportation system for the public schools. And we're going to really be, we're going to need to work together. So yeah, I think it's great. We can talk, depots, sharing routes. It would probably require some of the barriers that we hit is that we only receive money for the transportation system based on ridership and on the miles we run.
Right.
Okay? So it would actually, for us, when we put students on municipal buses, we don't get credit for that. So we actually are competing with ourselves for the dollar, which limits the amount of dollars we can bring in to run our own system. So that's a barrier. But there's been some talk about how to get over that. And I think if there's a way to track the miles and track who's actually riding the buses, which the way technology is going this day, I just don't see why that wouldn't be a problem moving forward. I think so.
Well, I mentioned the discussions about APS having a board member here or board member on the transportation board, but in a way, it almost seems like a member on the transit district would be a fit if it were if that became a venue to kind of work with, like you said, state statute that the transit district is tied in with the feds in terms of transportation, and maybe there's some opportunities there.
It would require some changes in statute at the state level, simply because, like I say, we receive all our funding state generated, and it's based solely on our ridership and miles. So, and actually, there's actually statutes that says we cannot spend our transportation dollars in a municipal system. So we're actually limited by law. We couldn't do that. And I think it probably goes back to who's riding, how's the dollar being spent, how are you making sure that the right people ride it. But I think those are all obstacles to be overcome. It's just going to take a little longer than I think.
Maybe the state can help us with that.
I think so.
Thanks. I want to give Ms. Armijo a chance to speak if she'd like. We always try to acknowledge our elected officials when they're here to weigh in. And then, just for the record, we want to weigh in on sort of what is the fiscal impact for this, because I think at the end of the day, it's always about dollars and how do you make these things happen, and we've got some of that data. But Ms. Armijo, welcome. Thank you so much. And you're from District 6, right, which is like the middle of the east side of the city and most of the East Mountains, I think, for APS.
Exactly. Thank you. Thank you for this presentation tonight, too. I'm here entirely in support of this effort, and I've been watching it closely, and I've been watching the work that these young men have been doing over the last few years. So I'm incredibly excited to learn how we can all work together as the city, the county, and APS. So again, I'm incredibly supportive of this initiative and look forward to working with you to figure out how to get over some of these barriers.
Thank you.
So thank you.
Thank you, ma'am. Commissioners and councilors and Mr. Chavez, I think the reason we wanted these folks to come is, one, because the city is in the middle of our budget process. They brought this to us just in the right amount of time, and as they mentioned, they took this to the city's Transit Advisory Board last week. I think Mr. Ramirez is a new member there, in fact, from our district, right? And received unanimous support there. Mr. Bernie Toon, our transit director, was there taking notes, listening, and since then, we've been able to do a quick fiscal analysis. Back of the envelope tells us that in order to, there are some models for this. In fact, we have 26 different transit passes. We probably don't need that many, but we do. And there are models for this, as folks have mentioned, like UNM and CNM. Those passes are available for students of those institutions who register to use their student ID as a bus pass, and they're supplemented by C&M and UNM to the tune of about $190,000 a year from those institutions in total to help their students access their facilities. And so the original model was something like this. According to Transit, the estimate is that it will cost about $500,000 to augment or offset the cost of providing universal student bus passes for APS students based on the data in part that Together for Brothers got us about the percentage of students who use them, and based on the information that the data we got last summer by providing some temporary bus passes and looking at ridership. And so what we are in a challenge to do is to find out if we support this initiative at our individual agencies and individual governments, is how we come together to try to fill that gap in the transit budget. Because the alternative is, because of the way transit funds work, if we issue these outright, we're putting a $500,000 hole in the transit budget, and that means they have to cut between 2 or 3 different routes citywide in order to compensate for that. And that certainly is sort of the antithesis of what we're trying to do. And so I'm going to take this back to the city. We're continuing to work with our fiscal folks. I know the commissioner has been a real champion for this. I know our APS folks have been a champion in helping us to look at ways to share the funds that we can or identify different funds that might offset this. But I think we're up to the challenge. We have about 30 days until the end of the city's budget process where we have to make this decision. And I'd love to see us try to do as much of this as possible. And so we're, from the city side, have committed with transit, and they have supported this if we can help solve that gap to making this a reality. And I want to commend the young people for doing this. But I want to open it up and offer, just in case from the county or others, to sort of weigh in about other ideas, whether it's Mr. Cog or others, and how we might do that. But we're going to make it a priority from our office and from the city to see if we can do this. So thanks. So thank you, gentlemen, for coming down. For what it's worth, the city's budget on transit presentation will be next Thursday at this time in this room, I think, if I remember right. And so for folks interested, please come join us next Thursday at 5 p.m. in the council chambers. Next up, our old business, continuing our behavioral health initiative discussions. Ms. Outram, we put you on the spot earlier, and now it's your turn for real. We're asking for status updates and your directions going forward from county programs. And I think you have the next item, which is subcommittee stuff too, I bet.
Yes. Thank you, Mr. Chair. So what we have moving forward is actually, we expended about 97% of the dollars that we have been given already. And what that means is that we've earmarked dollars, we've followed our strategic plan, we followed the plan from our business plan based on what we should be doing here in Bernalillo County. On Monday at 9:30, we will be having a working discussion with the County Commission that's going to talk about the future of the behavioral health dollars and what we want to spend on next. We will have a pot of money that's a small pot of money that's one-time dollars, and then again, if the revenue projections are right, we do have a little bit of an increase in recurring dollars. And so what is it we want to invest in next, and what is it those subcommittee members can work on? What we've been working on now, though, is really working hard and fast on implementing a lot of the programs that we said we were going to implement, going out to request for proposals, and then going through some evaluation process with UNM ISR that does basically process evaluation, and then we'll do substantive evaluation later. We've been gathering data. We've been doing contract compliance and monitoring. And so I think that the next phases will be great for us. The big implementation phases that we have are the crisis center, the triage center, and this is really a crisis continuum that we've been working on putting together. You'll hear a little bit more about that, I guess, in item, I don't know, 3 or 4, unless you want me to keep going. And then, you know, and what we're doing here on the MATS campus that's going to really be assisting in the build out of the crisis continuum and step down services. So, sure.
Thank you very much. Questions? Next up, I think, don't go too far, because you're right, you and Ms. Pierce are going to swap off here. I think next up, Ms. Carol Pierce from the city on reporting on the city's behavioral health initiatives. Just a quick update.
Thank you, Councilor Davis and fellow commissioner. I wanted to highlight one piece of our behavioral health program. And we've talked before a little bit about the SAMHSA grant, and this was really a collaborative initiative that the city applied for to really address a gap in our behavioral health system. And so the city was very fortunate to receive a 4-year grant, about roughly $1 million a year. Right. This went through city council a few months ago. And so we're just now in the process where those contracts are getting going, one with the Second Judicial Court, one with UNMH, one to begin to look at individual contracts with attorneys, although we haven't identified those attorneys yet. There's been an announcement going out in a legal newsletter to try to identify attorneys that want to participate, as well as there will be a contract with UNMH about fidelity to the model, because this is really research looking at people receiving treatment that are 18 years of older that the court may need to say you need to stay in treatment. And what excites, I think, us all about this is I think when we're all in the community, we've had people approach us to say, oh my goodness, I have my wife, my husband, my daughter, my aunt. It just happened to me this week when I spoke Tuesday night to a group and said, what do you do? And so this is where the court can get involved to really require that they have continued, sustained support and services and get the wraparound services people need. So I wanted to highlight that. We'd been talking about it in the past, but really now, really this is getting going, and you'll see more about this in the future, and that's what I wanted to highlight tonight.
Thank you, Ms. Pierce. It's been watching those grants become available is sort of the end of a long time process of community improvement and in community involvement, so thank you. Next up, I think we're going to keep you ladies together, Ms. Pierce and Ms. Holtram, to just give us an update, as you mentioned, on the Substance Abuse and Crisis Triage Center, as well as on the joint child abuse prevention efforts from the city and the county, and so we'll let you both figure out how to share that.
Sure.
Okay. On the crisis stuff?
Sure.
Okay. Okay. So as we've discussed, we've been, the Behavioral Health Initiative, based on what we have known in the past in terms of what Bernalillo County and the city of Albuquerque needs, there were really 4 categories that we've been working on. That's prevention, intervention, harm reduction, supportive housing, community supports, and of course a crisis system. We've been busy putting a crisis system and continuum in place, which includes mobile crisis teams, of course, working with the city on getting those implemented and then ramping up for more teams. We've been implementing CET, which is our community engagement teams, which really responds to pre and post crisis, so that we are de-escalating individuals before they actually get into crisis in the community. And then as well as trying to utilize the NMCAL 1-800 number in order to access mental health services in real time. And then the pilot project that, of course, Bernalillo County has had for a while with our 911 dispatchers linking New Mexico Crisis and Access Line into the 911 system on non-violent or non-threatening behavioral health calls. And so these are things that we're trying to do in order to establish a crisis system within the county and within the city. Next up are the really hard lifts and the things that we've been trying to move, and that is actually crisis triage stabilization. Now, Senator Mary Kay Papin a while back passed a bill that allowed Medicaid to pay for crisis triage centers. And we were happy for that, but we had to go back and amend the bill to broaden that definition to a 23-hour facility and then 24 hours or more, and allow hospitals to do that. Part of the statute, or part of the bill, required the Department of Health and Human Services Division to actually promulgate rules for not only Medicaid funding, but rules to implement for crisis triage centers, which are at max, because of a federal rule, 16 beds. And so we have been working diligently since those rules came out recently on getting things licensed over at the MATS campus. So what we are trying to do over on the MATS campus, which we hope to have a new name soon, because it sounds too much like medication-assisted treatment, is that we actually are working towards getting a crisis triage center licensed. This would not necessarily immediately be open for the public. And what I mean by that is one of the big problems and one of the big resolves that we had to really face is that we've got a couple of very big UNM, and then you've got casemen that are taking on those emergent crisis folks. It's that step down that they don't have. And so we've had to listen to providers that said this person didn't meet the criteria for inpatient stay. And we've had to listen to law enforcement often say they go in and they come out because they didn't meet that criteria and that threshold to stay in a facility. And so what we want to be able to do is have these hospitals be able to have an option to say, you know what, not an inpatient stay for us, or maybe you did qualify for an inpatient stay, we can no longer keep you, but you would benefit from stabilization, let's go here. And so we utilize the beds in that way in order to stop quickly a gap that is within our community. And so that's what we're planning on, that's what we're trying to shape up. In order to do that, we're not just talking about 16 beds. The exciting thing is that we're talking about 48 beds that we currently use in detox, and that is, we will be using that as observations. So everybody's heard of the PIP program, I hope, please tell me you have. At least we want law enforcement to know what that is, because it's a great diversion program. Instead of just focusing on that addiction piece, we're going to focus on that mental health piece too. So we'll be taking on individuals who have a mental health issue as well as a substance use issue. We will be stabilizing and observing them for up to 23 hours, and then we will be placing them in the right spot on the campus. So do they need detox? Do they need crisis triage services? What do they need from there? And so Turquoise Lodge is actually moving out fully in June, but they did vacate the bottom 2 wings, which is where we're starting, and once they move out fully, we will be able to really expand additional services, and with the help of Centers for Medicare and Medicaid to tell us what we can get reimbursed on, we'll be able to start building out some residential services on that campus. So I hope that's kind of the bigger picture of what we're trying to do. And we're actually trying to do it fairly quickly. So we submitted the licensure packet. We're back and forth. We're waiting on a site review from the Department of Health, and we're on it. We're cracking the whip.
That's a lot of progress in a relatively short amount of time for a big project, so
Yes.
thank you very much.
Thank you.
Director Pierce, anyone add anything to that one?
Yes, what I'll add is maybe start on 2 specific pieces that we try to contribute to the system on substance abuse treatment, and then kind of telescope out to a little bit bigger. But 2 pieces that the city is funding: intensive case management services for people with substance abuse disorders, and that's about $750,000. And that's that important piece that we're doing a contract with UNMH, and we just think that's a piece of the puzzle, just to, again, try to provide that service. The other thing that we're really excited about is the Substance Abuse Treatment Provider Network. So that's another way that can really address a gap. We've funded that for about $1.2 million. I got the figures. So far this year, we've served about 415 clients. That's about 7,700 services billed. And again, that's that gap that they, as Katrina is eloquently saying, they may not be eligible for Medicare, Medicaid. This is a gap. This is what we're serving now. Over the time this service has been available, it's about 1,700 clients have been served, and 43,415 services have been billed. So again, it's a key gap in the system as we're trying to work together to address those critical substance abuse needs. And then if I telescope out, I've mentioned it before here, but I think it's so important. As we've really been working hard to address the needs of our individuals who are homeless, as everybody knows, we currently do that 20 miles outside of town, as well as working with our providers in town. We are grateful for the support of the county as we're working together to buff out our transportation services, to have more pickup sites, but also through the support with the county, we're adding case management services to our West Side facility. But as we hope the voters will approve, and it will be on the ballot in November for $14 million to bring those services more centralized, we just know that the symbiotic relationship, I think that's how I'm going to describe it, between what happens with behavioral health triage with the county, what we're doing to try to meet the needs of homeless individuals. It's like a Venn diagram. I mean, the county's doing the heavy lift on behavioral health crisis triage. We're doing the heavy lift on homeless, but there is this crossover, and we both recognize that. And as these facilities or options move forward, we're just going to have to always figure out how we work together on that.
Thank you. Commissioner?
Thank you, Mr. Chairman. Substance Use Disorder Treatment Network, what is that? Is that like a network of providers?
Let me make sure. Yes. And UNMH, the contract's with UNMH, and then they're getting the providers to work on that. It's a system of providers that are providing that intensive case management.
Okay, so so that's, the 1.2 million is going for case management.
You know what, let me get that right. So the Substance Abuse Treatment Provider Network, that's not the UNMH one. There's about 7 different agencies that we contract with to provide that treatment, to provide that gap treatment, about 1.2 million.
Excellent. And how are people referred into that system?
It's by word of mouth, people knowing about that. We recently did something on Channel 13 to try to get the word out that that's available. So we're always trying to get the word out. It's a matter of people knowing and knowing those treatment providers. When we get calls through 311, we're often connecting people to those. But I do think that we have a need to get that information out there more.
Yeah, because this is the first time I think I've heard of it, so really good to know. Do you have any idea what the wait times are? So say somebody wants to access treatment, to opioid use disorder treatment. Any idea what the wait time is?
Commissioner Hart-Simmons, I do not know the wait time. I think that's a good question, and I can find that out.
Okay, and I don't mean that in any way it's just people ask me. I will often get questions from people. My son is looking for treatment. Somebody coming out of jail is looking for treatment, whatever. It's unclear to me like where to send them sometimes. I usually call Katrina and she takes care of them somehow. But there also is that question, like how long is the wait for somebody to get that treatment?
Madam, or Mr. Chair, Commissioner Stebbins, it also depends on the type of treatment that they want or need. So IOP, intense outpatient treatment, will be a different length of time than it will be for OP, just as outpatient treatment, or somebody that wants to get on medication-assisted treatment. So all those are variables. The other big variable is what's inpatient or what I consider to be residential, and what's outpatient. And so, inpatient is harder to get into a lot of times. They're the ones that are taking up a bed and have a waiting list. A lot of times, outpatient treatment services, you can get them assessed and in rather quickly, but it really depends on the type of treatment that they want. Yes.
Thank you.
That's a great question. I just want to follow up, and Mitchell, from a conversation we've been having for a couple of weeks now about how, Ms. Pierce, how is someone referred to those programs? I understand if they call 311, but do our police officers have access to this? And who does that? How is that triage or done in terms of this is an inpatient caseman or UNM issue versus provider network referral for the next couple hours, 48 hours or something?
In terms of accessing the substance abuse treatment provider network?
Let me just make up a scenario. I mean, whether it's a first responder on the street who says, clearly there's an issue here, and my options used to be caseman or UNM, and they walk out the back door. We know that we're going to start directing folks there to a new program at MATS. But this as well, who makes that? I'm just curious, who makes the decision, or how are someone triaged for the right program?
Thank you, Counselor Davis. The primary connector in most of these programs are case managers. Okay. So we currently fund case managers. As I mentioned, we'll be doing that through the county out at our west side. But right now we have from HopeWorks, there are case managers that go out there all the time. So their job is to know about all these resources. And then I think Katrina spoke eloquently about it depends. Is it intensive? Is it outpatient? But they know about these resources, and they're the ones that are connecting them to what's the right fit, depending on what the need is.
And Mr. Chair,
yes,
also each program and each provider network will screen individuals for the appropriateness for the level of care for the service they provide.
Thank you. And Ms. Oderman, I just want to follow up. I think I had a conversation, our conversation about how do our first responders start to know about the county's community engagement teams, for example, or these new resources. And there's an opportunity for, whenever you're ready, for us to film an APD TV and an Albuquerque Fire TV piece to sort of introduce these new ideas, and they're anxious to do that. I think they'd love to showcase some of the work the county's doing to our first responders, particularly in the international district where some of these pilots are kicking off.
I'll glass up.
Great.
Thanks.
Thanks.
Yeah. I do
Yes,
want
ma'am.
to add, when we talked about our joint funding on mobile crisis teams, because those are really important, and that's another opportunity because they're on the front line finding whether they're with a first responder, somebody in a mental health crisis, to further then connect them to some of these resources.
I think that's a good segue really quickly into the updates from both departments on our city and county efforts on child abuse prevention, which overlaps with so many of these services. Do you all have a quick update for us on that?
Sure, I'll start on that one. Thank you, Commissioner. There are, we've got several updates. I think, first of all, I need to talk about all that we're doing in our youth programs. We believe that when you really talk about child abuse, you've got to go way upstream. And our department is particularly poised to respond with our 25 child development centers. We're serving over 800 children. We see their families day in, day out. We have a parent advisory group. That's where we're talking about and those protective factors and can identify if there are concerns. We also are one of the larger before and after school provider, as well as our summer program. We'll serve about 23,000 students this summer in our summer programs, and then on a routine basis in the school year, about 10,000. So we think having positive role models, that positive programming that we do, those are some of the protective factors that we need right there. We do believe that the work the city is doing on housing vouchers, that's a way to get people out of harm's way, off the street, whether it's rapid rehousing, whether it's motel vouchers, or what we all want in the long run, which is permanent supportive housing. And again, the county and the city have a joint project there. But housing is key to get people off the streets and a resource for children and families so they're not in crisis. I think all that we've been talking about, the behavioral health services and addiction services, that is one of those core services that families need, and that relates to child abuse. People need the treatment so their families and children are not in harm's way. And I know APD, if they were here, would talk, they have their crimes against children unit that they're working on. I think our department has an opportunity to do some important fine-tuning and system work, because we have been talking about this recently in light of the tragedies in our community. Since we are doing this rapid rehousing and motel vouchers, and since we do have 25 child development centers, we think that we need to work with all of our outreach workers that are helping getting people housed. And one of the first questions we need to ask if they have children, do you have care for your children? Because we need to have a system that we can get children access. Now, we don't have the ability right now. We have some open slots in our program to place them, but we think we need to work as a community and other child development providers to really quickly be able to place children. We don't have that system in place now, and I think that's something we need to work on as a community.
Ms. Pierce, what would it take to build a system like that?
Well, that's a good question. I mean, we've begun to talk about it. We do meet with some of our fellow child providers, APS, YDI. I think it's a matter of, and I would, from my background experience, I would equate it a little bit what our ERs have to do. When you have a trauma center, you need to go in on a daily basis to say, how many beds do you have available? And that's what helps our first responders to know where do they go, who's got the bed availability. It's really a similar system on who has child development slots. So it could be as much as that we agree as a city that we have a system in place. I think we've got the technology. It would just be working with our providers and to put that information in there so we'd know.
Is that this will be my last question, I promise. Is that something that, we do provide grants to many of our early childhood providers as well. We do our own centers, but we also do grants to a majority of the ones that I'm aware of. Is that right? Some are funded by state funds or some are funded by us.
Well, thank you, Counselor, for asking that question. Of our 25, we get federal dollars, Early Head Start. Those are our own city employees running that. We do state pre-K. Those are our own city employees running that. And then our own preschool city employees. We do few grants really to have other providers run, very few. We're doing the lion's share of that with 800 services. So that's why, to really buff this out, we could go so far, but we would need to connect with YDI, APS, the private providers out there to really map who has child development slots.
Ms. Outram, any updates on that?
Thank you.
component?
Well, you know, the county has a lot of mirror programs that the city is talking about in terms of parks and rec and really getting and involving our youth in after-school programs and meals. And, you know, they do a phenomenal job at trying to curb what we're doing, especially through ABC schools. And so, you know, rather than talk more about that, I just think that what we're really talking about is not child abuse prevention, but it's going far enough upstream in order to really figure out the social determinants of health, which is, you know, something that Director Pierce and I have talked a lot about in terms of how do we get to the crux of this issue and start changing the tide for these kids, these families, these adults. And so we've talked a lot about how you know, even the healthy foods, even, you know, housing, the supportive housing pieces, and connecting families and stabilizing families themselves, high-risk families in single-site supportive housing is critical to what we're doing to change the tide for the kids so that they don't have that pattern, that generational pattern of abuse. And so that's where I think we're focused, and I think we're very much aligned in that. And I think we can all do a better job, you know, especially since we have access to parks and recreation and these sorts of things, to start screening quickly and identifying at-risk youth, and that's something that we'll be talking about, I think, in the near future. There's a couple of things that we do. Of course, we've spent $3 million in our ACEs program, and that is to really reduce adverse childhood experiences. We've served a lot of folks on that. And we're seeing a lot of good outcomes, but we hope to see longer longitudinal outcomes of that to see where the kids are shaped. We also have peer support drop-in centers that are for youth that are relatively new, but we've rolled that out in conjunction also with the city. Youth transitional living, which has served right now over 300 youth at this point, but we know we need to do more. And again, I just want to highlight what we do on the MATS campus in terms of our Milagro program in serving these individuals or these moms who are pregnant and recently postpartum with addictions, and we're giving them the life skills and the training, and that's actually also an avenue into permanent supportive housing for these individuals as well.
Katrina, I have a question. Councilor Davis just asked me if we fund any home visiting programs.
Thank you. Yes, we do. We actually do that through our ACEs contracts.
Okay, so through our ACEs RFP program, or RFP process, we did have providers apply and were chosen?
Yes.
Who's providing those services?
I will have to get back to you on that. Okay. I just have the names of the providers. I wasn't smart enough to get all their scope of work.
Thank you.
Oh, we have it right here
But
for
someone
my
might
brain
know.
trust. Peanut butter and jelly,
New Day.
New Day, and All Faiths.
And they provide sort of home visitation for new parents?
Mm-hmm. It varies. So New Day is, Margarita Chavez, commissioners and counselors. Peanut butter and jelly does prenatal through, I believe, 3, and then the ages vary based on each contract. So it was intentional that we hit a cadre and a full age spectrum in that.
Great, thank you.
Always know somebody knows.
Counselor and Commissioner, if I could make one other comment, because I think it ties together a few things, and I'm glad Katrina mentioned the Community Schools Initiative, which the county funds, the city funds. It's a really important partnership with APS as well as the business community. And earlier we heard a speaker mention the school-based health program. That is one of the pillars in our Community School Initiative, is that integrated health supports. And I did want to just mention that in a school-based health center, every student, and this is part of the standards for that program, takes a student health questionnaire once a year. And that identifies some of the protective factors, the at-risk factors. So I just want to link that back to what we're already funding. Working on that with APS, it's also really an important piece of the puzzle when we're looking at child abuse and protection.
Thank you, ma'am. Thank you both. Katrina, Ms. Hotram, you have one last thing, a living room model, which I have not heard of. Is that something we should do tonight, or you're prepared for this evening?
I am prepared tonight. I think
Great.
we just wanted to inform the ABCGC that this was going on and that we were going to move this along to the Bernalillo County Commission at a commission meeting in a future date. I know that I do have our committee chair, Ms. Dr. Kathy Finch, who can also talk briefly about this. She's with our community supports. But basically, we've talked for a long time, or initially with the ABCGC, about partners and getting partners not only in Bernalillo County and with the city of Albuquerque, but expanding to other places. And of course, we have an unincorporated area, which is Tijeras and Edgewood, and we have an opportunity to provide services for individuals in the Edgewood area, where 30% of these individuals are accessing services anyway. So we are working with First Choice, and we are asking, or we're talking to you about this proposal tonight to move this to the Bernalillo County Commission. A living room model is simply a social-based model program that takes pairs a peer with a counselor and allows people to come in for a longer period of time so that we can actually stabilize an individual over weeks and have a transitional service plan with them. It also prevents, we believe, people from coming from Edgewood into the emergency room system. So I'll turn this over to Dr. Finch, and then we will, that'll be it.
Kathy Finch, good evening. Are we all counselors or all committee? We're still both. Good evening. The living room model is a very interesting thing. It's, as said, a social model where there's a comfortable space that people who are having mental health problems, crises, can go into and have a quiet, non-emergency room fluorescent experience with peers who are able to help de-escalate and share their experience as well as their training to help formulate a plan for the person who comes to see them. It may be just a one-time visit. It may go on for weeks. It is not a medical model. You don't make a diagnosis. It's a functional model. How do you live with this so that you can make the most of your life and not be caught in it, but move on to recovery? There is a very interesting conglomeration forming. Santa Fe County had some money. We have some non-recurring funds, and they're going to be pooled. Santa Fe County has a venue for this where the old federally qualified health center was, and it can be in conjunction with that, but a separate standalone thing. Maybe Torrance will be involved. It turns out that in the last half of 2018, 400 admissions to the UNM psych facilities were from Edgewood zip codes. So it's definitely impacting the city and county, but it's at a juncture between Santa Fe, Torrance, and Albuquerque, and there is, at this point, about a 50-50 blend in funds. Maybe, given that we have some recent Albuquerque commissioner experience in Torrance County, they can be pulled in too. It's a whole different model. It is something that can utilize citizens and their experience in the rural areas. We've been working with a nationally, internationally known person who developed the living room model, and are hoping, with careful observation, to have something that can be useful in more places in New Mexico. May I answer questions? Do you have any?
Really quickly, and thank you for being patient with us tonight. And for
Absolutely.
giving us this. I think this is it's a really innovative way. And again, it's plugging those gaps and looking for sort of the lowest option that makes sense for folks. What do we think is the timeline to bring this on? And again, where does it fit in sort of the referral model? Like, how does someone access this service if they seem to be eligible?
Well, Santa Fe has the money and is going to do the redo, and I think they're interested in starting within the month. And this could be, I mean, it's going to go out for responses to our proposal, and that will take a period of time, but it should be what?
Well, actually, this one won't, because we're going to partner with First Choice, who's going to be the, we're going to partner with First Choice, who's going to be the provider. So when we say that Santa Fe County wants to start this, they want to start the construction on the building, the old First Choice building that was out at Edgewood. So we're not exactly sure when those renovations would be finished, but then we'll start after. The nice thing about this model is that this will be 3 years. On the 4th year, they will be self-sustaining on their own income. So these are great ones that you want to fund, because then you can go on to funding something else.
So can you give the total cost, what the county's contribution is, what Santa Fe's contribution is?
Sure. So we have, let's see here, that the one-time allocation of up to $333,000 for 2 years, for a total allocation of $660,000 from the Bernalillo County Behavioral Health Initiative is requested. So Santa Fe County, who will be investing dollars, I think $530,000, which will be a blend of capital dollars and the first year of funding, and we will pay up to 2 years of funding. And up to that amount. So they will, as we get along with the billing, they will bill Medicaid and not charge us, and we will move down on those numbers.
So the county, and so the Santa Fe County funds, Bernalillo County funds would be for overhead expenses that aren't reimbursed through the, through Medicaid or
That's right,
private
but there's,
insurance?
yes, but there's also a setup time as well. Because we haven't done a lot of peer-based billing, and so there's going to be a lot of transition with that and a lot of training with that. So the sustainability will be over a total of 3 years. We wanted to do the max amount. We anticipate to see the amount actually decline.
Great, thank you.
Thank you. Thank you.
Thank you.
That concludes our regular agenda. If there are any other business from folks on the dais, seeing none, that concludes our business for the night. We appreciate everybody's patience with us this evening. Our next meeting is May 23rd at 5 p.m. in these chambers. Ooh, it's been a long day. There being no further business, this meeting is adjourned.